Hey friends, this is Dr. Pawan, second year urology resident at Max Super Specialty Hospital Saket, New Delhi, and I welcome you to the first podcast of this particular series. Here we are trying to connect with urologists doing great things and having great careers in different parts of the world. Now, what we are trying to do over here is trying to connect with them, dive deep into the journey, and try to understand what decisions they made and how those particular decisions gave them the experiences and how it basically shaped their career, and hopefully learn something from this particular kind of conversation. So, in the first podcast of this particular series, let me just invite you, Dr. Harshit. So, Dr. Harshit is one of the most brilliant chaps I have ever met in my life. He did his MBBS, MS, and MCH from AIMS, New Delhi, and then he did his robotic fellowship at Max Hospital Saket. And when I basically joined Max Hospital as the first year resident, he was a fellow, and that was a time where we bonded and thoughts kind of matched, and we ended up becoming one of the very, very good friends. And after completing his fellowship at Max Hospital Saket, he moved on to US, where he is at this point doing his fellowship, the surgical uro-oncology fellowship at University of Texas Health, San Antonio. And today we have a privilege of connecting with him and trying to understand the different decisions which he took during this particular journey, which ended up giving him one of the good careers in this particular scenario. So there are multiple thoughts which cross my mind when I try to figure out what I want to do after completing my urology training at Max Hospital Saket. And I ask him a lot of questions, and he has been kind enough to answer so many questions which I had put forth to him. And I requested him to kind of shoot this particular pod. So let's dive deep into the journey of Dr. Harshit Garg and try to understand the pathway which a urologist can follow if at all he or she wishes to kind of move to US and pursue urology as one of the career paths. So let us have Dr. Harshit Garg. Hello everyone. Today we have the privilege of having with us Dr. Harshit Garg. He is at present pursuing his fellowship in surgical uro-oncology at University of Texas Health San Antonio, and he will be talking about his journey, his pathway, and will be sharing certain tips so that like anybody of us who is willing to go down this particular pathway will gain something out of it. So let me just welcome Dr. Harshit. Hello. Hi Harshit.
Hi everyone.
Right. So thank you so much for taking out time to connect with us. Let's start away. So please tell us about yourself and please tell us about your journey so that I know about it, and let's our viewers also have some knowledge about it.
Yeah, thank you, Pawan, for having me and giving me an opportunity to share my experience. I know a lot of people would like to know about a lot of stuff about fellowships in America and their journey. So briefly, for everyone, I'm Harshit Garg. I did my MBBS, Master of Surgery in General Surgery, and MCH Urology, all from AIMS Delhi. And then I did 1 year fellowship from Max Hospital Saket, where I had the fortune to meet Pawan. So I did a fellowship in robotics and uro-oncology there. And then I got lucky, so I landed up to do a urology oncology fellowship in University of Texas Health and Mays Cancer Center, which is an MD Anderson Cancer Center at San Antonio in Texas in USA. So yeah, that's I'm a second year fellow here, and yeah, that's all I think.
So, you already had a very established career in India. Like you did your all the training from AIMS, and you did your robotic fellowship here in India as well. I'm just curious, what made you take this particular step of deciding to pursue your USMLE and why did you decide to go ahead and pursue your training in USA at this point?
Yeah. So actually, I always wanted to become a surgeon. So that was, primary goal. And when I got exposed to urology and AIMS had, the stuff on robotic surgery, was the first institute to do robotic prostatectomy in India. So there was always keen interest, to go into the field of robotics and urology, oncology. So I did my fellowship in India though. But we always have in mind that the training in United States or even abroad outside India is better. And when you talk of training, you will that. I think that's a consensus. Most of us will believe that training in United States is far, far better as compared to any other country. in the world. Of course, there could be some exceptions in Europe and in England, but as a broad, like as a general talk. So, and you always want to get trained in the best of the best institutes. So this just drove me to come to States, and so I just planned. So I was not very 100% sure that whether I'll get it or not. And as we'll talk more about it, you will know how difficult and how much challenges you face when you come to States. But that was the main motive, that you get to get the best training from the good centers or the excellent centers, especially in the field of urology, oncology, and robotic surgery. Yeah.
Okay. So we will talk about your what the expectations were and are they being met in further in the talk. Let me just ask you, when did you give your steps? Did you give it when you were doing your MBBS or when you were doing your general surgery training or urology? So please tell us about your experience of taking the steps in India.
That's a very interesting story. A lot of people ask, when should we give step? So I just, as a matter of fact, I'll say, whenever you can give step, just give them. Whenever you have time, just give them. If you have in mind any moment that you think that I want to go to States and I want to practice or I want to learn, do some training, something like that, just give the step whenever you feel so you have time. And so interestingly, I did not plan to give steps very systematically or meticulously. I was an intern at AIMS and I was very hardcore PG preparation candidate. I studied in a lot of coaching institutes which are still popular where for your PG coaching. So just not to name them. But what happened during my internship, I had the opportunity for 2 months to come to University of Pennsylvania in Philadelphia as an exchange scholar from All India Institute of Medical Sciences, Delhi. So when I was there in Philadelphia, so I just realized that ECFMG had their office at Philadelphia. Okay. And where I used to stay, so it was only half a mile from my apartment where I was staying within the university campus. So one of my friends told me, you're going to US, so why don't you give your step? You're already preparing for PG. And so, of course, I was very nervous to give step 1 or 2 because you can give that in India. But the thing was that step 2 CS, I think, which is not being happened for past 2-3 years because of COVID stuff. So step 2 CS, Philadelphia was the center. It was near my home, apartment complex where I stayed. So they said, just fill in the form and, get an appointment there and just give your step 2 CS. And I was really nervous. And so I started my journey reverse. Normally people would give step 1, then step 2 CK, and then step 2 CS. But I gave my step 2 CS as my first exam. And so that was pretty interesting because I was already a clinical student as a MS4. I joined as a medical student 4. They call it MS4. So I was already interacting with the patients in University of Pennsylvania during my rotation in surgery. So I got to know how to talk to a patient. Then a couple of medical students there also helped me. I told them I'm giving step 2 CS. And so I used to practice at Starbucks there. That's the standard, like a Nescafe in India. So I gave my step 2 CS at that time and very nervous, but I passed. So that you just have pass and fail in that. So that was the time I gave my step 2 CS. Then I joined, just after my MBBS, I joined my surgical residency. So in surgical residency, I think in most of the institutes in India, you have some time during your super specialty rotations in various departments like urology, cardiac surgery, GI surgery, and all that stuff. So during that time, there were some cooler postings, you call that. So during those time, I did my step 1 and step 2. That was a difficult, bold stuff because, during surgical residency, you have to find some time out to study for the steps. I was not very meticulous because I was not planning to come in for residency. And people told me, if you want to do super specialty training, your step scores won't be that much of importance rather than having, other good CV. So I gave my step 1 and 2 during my residency in general surgery. So by the end of my surgical residency, I was having my ECFMG certificate, which you technically get after your step 1 and 2. And then I did my urology residency in India. And one more thing is that you have to complete all of your steps in 7 years frame. So that's the time point. So this frame starts on the first day of your exam. So I gave my step 2 CS in July 2013. And so within 7 years, I should be completing all my steps technically. So I got the ECMG certificate within 7 years, but I did not have step 3 during that time. But for your fellowship trainings, you should be having your step 3, ideally. That helps you in easy licensing later on. So, but then into 2020, COVID came in, so the things got a little bit relaxed for the 7 years criteria. So I gave my step 3 after 2021, just before joining my fellowship. So yeah, so it's been a long journey,
So you gave your steps, but as I can understand from your talk that you didn't have a actual mindset that okay, whether I'll be going there to do my residency or whether I'll be going there to do a fellowship. So once you entered into your urology training, what was the time or what was the point when you decided okay, I am going to apply for a fellowship match and I'll make sure that I get it, and like if I get it, I'll be going there or something. So was this somewhere in during your urology training, or was it like you applied and you got it and then you decided to just go ahead with it? When did you decide that, okay, I'm going to pursue my fellowship over there?
So you need to understand some timelines, and these are some technical points. I think many people will benefit from it if I can throw some light on that. So basically, United States work 1 year ahead. So if you are going to plan if you think, suppose you are going to go for a fellowship next year or next to next year, suppose I call it an year X for you guys. So if my fellowship is supposed to start in the year X, and the month will always be generally July. So if I'm going to start in the year of July of X year, then my application and everything should be complete by X minus 1 year of July. That's technically for fellowships how it works most of the times. So they do, everything beforehand, that who is the fellow coming in. And so they do all the paperwork, they're foolproof so that they don't have any problem during their rotation with their institute. So normally, as a chief resident, so third year of urology residency is called as chief residency. So in India, you have a concept of chief residency 6 months, last 6 months, or fifth semester, sixth semester, when you're handling the ward basically. So many institutes might not have it, but if you're talking to anyone in the United States, your final year is called the chief residency. So you should label yourself, I'm a chief resident. You are doing whatever you can, but chief resident technically the managing the term. Right. So normally you should apply during your chief residency years. So when you complete your chief residency, either in July or December, as per your session of the MCH or DNB, so you will have sufficient time of an year while your process of application, interview, and process will take place. So you are able to next July to your fellowship. And so when I'll talk about how the American Urology Association match will take process, because not many of you would be urology interested, but I'll talk in detail how the AUA match process works. But generally, when you are a chief resident, you should start thinking that, okay, I want to go plan a fellowship. And even then you might have one lacuna year, because you are going was X year, and so X minus 1 year will pass. So you still have 1 year of gap. So you must find something where you can get good hands-on or good exposure before coming to United States. So that's how
the reason why you came to Max to do the fellowship. Okay. Just one quick question over here. So I was going through the timeline of the match as we recently had a word over the telephone. So what I found was that the applications closed by, it was different for different subspecialties, but they closed between March to April, right? And the results came by June. So I'm just curious, our step 2 results should come before February, right? I mean, so that we are able to apply, the step 2 results should come before the ending of that particular deadline of the application, right? I mean, that's what.
So ideally, not even step 2 result, you should have an ECMG certificate with you. So that ECMG certificate takes another 3 months after your step 2 result.
It takes
and step 2 result 6 weeks. Okay. And you should give them at least 3 months. That's that's a layman. They will say that ECMG is busy. ECMG is running crazily busy right now with COVID times. They are slow, super slow. So you have to give them time.
So and many fellowships will take around 3 to 4 weeks, and the ECFMG certification will take 3 months. So we should give our step 2 at least 4 to 5 months before the end of the deadline of the application. Okay.
Yeah. So that's, and even if you're applying for a residency, then step 3 won't matter. But if you're applying for a fellowship, you should technically also have step 3. So once you have your ECMG certificate, then ECMG certifies and notifies the body that now we are eligible for step 3. So that again takes a process of verification and all that stuff that you are completely. So you should have a sufficient window for even step 3 and the results. So yeah.
Okay, so that's fine. Tell us about the different fellowship options. Let's kind of talk about urology at this point. So, what are the different fellowship options which we have? Let's say consider urology at this point. So, if at all there is a urology resident in India at this point of time, and he or she wishes to kind of go to US and pursue a fellowship, what are the different options and what are the different pathways available for it?
Okay, that's an interesting question. So basically, when you do your urology residency in India and you want to come to States, so there are two pathways. Either you come through the accredited fellowships. Accreditation means two ways. One is accreditation by the GME office, which is Graduate Medical Education Office, which is classically for residencies. So anyone who does residency in US, so they have to have certain criteria to be filled by the program, and then they accredit that this is a GME accredited program. So when you are a GME accredited program, so you get a license very easy. You're board certified basically, because that's the body that takes care of all the boards. So you are board certified. So that's one way when you come. So that's one accreditation, that is GME accreditation. Second accreditation is a society accreditation, which is for urology technically is American Urological Association accreditation, or there are sub bodies in that, which is Society of Uro-oncology, which is called SEO for Uro-oncology, which is GURS, which is Society of Urinary Reconstructive Surgery, which is again Andrology Society, and then you also have an Endourology Society, which is a world society, but they collaborate with AUA for the American Fellowship Program. So all the American Fellowship accredited program by the society accreditation comes under the AUA. Not all of these programs are GME accredited. Rather, most of them are not GME accredited, because if you are going to follow the GME accreditation, you have to have certain very rigid specification on work time, hours. So society has tells them, because it's super specialty training, we need to focus on the aspect which the candidate is more interested, rather than giving a holistic training of broad speciality. So that's why most of them, they do not follow any GME accreditation per se. You just have a society guidelines, and then society gives you a certificate, and so that doesn't count for your board certification so easily, because you are not GME certified. This is all stuff when you're talking about accreditation, GME or society. Then I talk about non-accredited fellowships. So there are a lot of pathways for this accredited fellowships. Particularly, you should be coming mostly through ECFMG, because that's the body which handles the international medical graduate affairs. And second, you have to be on through the university on paper, very much formal stuff happening. The second stuff is non-accredited fellowship, which are easier to get, which are basically a professor you know of. He has got some funding and he wants someone to work from him. Okay. And so you work with that professor. That professor has to fund your salary. So he has to show some funds which is available either through grants, charity, donation to the institute, or billing which he's able to generate. But some funds should be there for his salary. And so so you work with that professor. He decides you want to work for 1 year, 2 year, 3 year, based on your mutual. There's no limit on that. And mostly you are given the title of clinical lecturer or a lecturer or clinical instructor or instructor. And of course, you will technically call like a fellow there in the department hierarchy. But on paper, mostly you will be like an instructor or whatever that department decides for you. So these are non-accredited fellowships. So there are two pathways coming in. So second pathway is simple jugaad in one line. If you know anyone, you drop an email to him. He will take you or he will leave you. So that's you mail your CV, you mail your letter of recommendations, whatever he wants from you. And so there is no official site for that. There is no official portal for that. You just need to be in touch in conferences, your networking and all that stuff. Now, when I talk about your accredited fellowships, so it happens through the match process. Now, I want to tell you, don't confuse the match process with your residency or national NRMP match. So that is a national match process for residency. Okay. Normally, all residencies in the United States happen through the NRMP, that is a national match. But American Urological Association separated the urology residency match from there. and they took the control over the urology residencies as well as fellowships. Like one of my friends, he came in for surgical oncology fellowship through a match. So, but that was through the NRMP because most things happen through the national match. But for urology, American Urological Association, Office of Education, has taken over this complete responsibility, and they will coordinate their residencies, they will coordinate their all sub-society fellowships, including a Society of World Endourology, which is, an international conference, international congress. Still, if they want to give their fellowships in states, they have to go through the AUA. So that's how it's working.
So a quick question. You talked about the accredited and non-accredited. Okay, so non-accredited, it is basically on the whims and fancies of that particular lecturer. So probably they won't be very well structured. Like every resident, every fellowship would be different from one another. When we talk about the accredited one, you mentioned about the GME and one through the AUA. What is the process of matching into the GME accredited? Is it also through the AUA only?
So there is no particular process. It's just like the AUA fellowships, whether they get accreditation from the GME office, yes or no.
Okay.
So most of the AUA fellowships have not got accreditation from GME office. I have got to know some people that urogynecology, some fellowships, because they're mostly done by the gynecologist. Mm-hmm. So they often have some GME credentialing. So they might get that GME credentialing stuff. But most the AUA fellowships, even if you have done residency here or not here, you are not, GME accreditation doesn't work for your fellowships for AUA.
So GME accreditation to get into the urology fellowship is kind of very, very rare. But if at all, let's say a couple of programs exist here and there, they are added advantage because that might help you to get a board certification a bit earlier or something like that, as far as I have understood, right? Okay, got it. Okay, so at this point of time, do you plan to settle permanently in USA? Obviously, you would have given a thought. And okay, maybe you have not decided, but what is the thought process which goes into your mind? Okay, these are the pros and cons of, let's say, settling down in USA. Let's talk on the fronts of the professional life, and then let's also consider the personal life and the economical aspects and all those particular things. So yeah, please share your experience, because that is something which haunts, I guess, most of us, like whether one should take this particular path or not, and if yes, whether it should be done for a temporary time, like you should just go learn, come back to their own native country, or you should try to kind of be there and make your pathway and like somehow penetrate the system and stay there for a long period of time. So yeah, please share your experience or your thought process behind it.
This is one of the big jeopardies for any international graduate who comes doing residency in India or even any Asian countries per se, and then want to come to States or any class A countries, developed countries. So first of all, we should, I'll just go slightly to depth, how you decide, how your thought process works, and why United States. You would have, why not any other country? So there are certain things when you have to make decision. So first we'll talk about professional life. Why is the professional life so good that people want to settle in States? So in professional life, you have two things, what you want. One, you want quality of work, which you are doing. So you don't want to, do some random shit. You want to do proper, good cases, scientific evidence. But at the same time, you also want money. You have to have good financial stability. So what happens in India, you can do, patients are everywhere and the patients don't run from across countries. So disease epidemiology everywhere. So why US and why not India? Because the patient profile is mostly same. The problem in India is because there is no structured healthcare system. So everyone is trying to hook up the patient with themselves. So even if there is always a gray zone in surgical fields where you operate or not to operate. So you tend to become more in that direction, which would favor you financially or which would favor the corporate hospitals or per se, which would favor your schedule. Like if you're in a government setup and you want to operate, then you would just delay that. So there are a lot of, gray zone areas which are left onto the discretion of the surgeon. And so the patient finally ends up doing doctor shopping. He'll get 5 or 6 opinions. And finally he chooses what he wants to do. And you don't like that because, he's a patient. There is something called patient-doctor's relationship, which is always hampered during this. And it is no mistake of a doctor or patient. They will do it again. That's how the world works. But when you, and so if you do the work in your corporate sector, you are getting paid. And if whatever you do in your government setup, you are on a basic salary. So it doesn't matter. So there is no incentive, to either work more or work less in both the setups accordingly. Now, when I talk of countries like United States has mostly privatized healthcare system with insurance in place most of the time and with a very rigid referral system. So if you are specializing and doing some quality work in one particular field, then you tend to get referrals from around the corner, even if you're in a smaller district, but all the district cancer cases, you will be getting operated because you are a referral center for that. So like now we have a Mace Cancer Center, which is an MD Anderson Cancer Center. So all the patients in South Texas, they automatically refer to this place for higher. And to simpler cases, they get managed there itself by their local physicians or their surgeons. But you get to do only good quality work. So that's one thing. If I tend to operate, 500 robotic partial nephrectomies or 100 robotic prostatectomies rather than doing 50 circumcision, 10 stones, 20 strictures. So that doesn't give me that satisfaction because the experience I have then in kidney surgery is far more higher than anyone, in the vicinity. And that will allow you to improve and then, of course, develop that procedure better. So that's one thing. And second thing is the financial stability in United States, because of being privatized healthcare system, you get a decent salary. I'll just say a word decent, but you are in the upper class of the society in United States as compared to countries where you have the NHS system, such as the Commonwealth nations like England or Australia. So you end up, you might, NHS is one of the second things. England, after United States, I think England is one of the second most common destination for Indian people to go, doctors to go and, settle or learn or train. And that's the reason I think predominantly language, because both United States and England, they work in the language of English, and we are all trained in English in India. So that makes things a lot of easy because communication is the key in medicine and in surgical fields. But NHS, the salary, there's some sort of capping on that because being a government system. So you tend to, work like a government setup in India, but so you don't stress yourself a lot. But then if you have the potential, to do more and to generate more money, that's a little bit limited in NHS system as compared to United States, where you can do a lot of stuff. The more you operate, the more you see the patients, the more you earn. And of course, you're doing the quality job as well. So I think when you talk about NHS and America, both have good quality care, both have the referral system. The money is great in America as compared to United Kingdom. And that's why people would like to come more for USA and than England. And that's very crudely put. So that's what it's the ground reality. So that's how we think. So these are the things. So professionally, if you want to settle outside India in any one country in the world, so number one would be United States, and there is no doubt about it. So that's for the professional reasons.
Question over here. So before we move on to talking about the personal life and the other aspects at this point, so one thing, at this point, I can see that many people are going from India to UK at this point of time because of maybe the opportunities are more over there. So whenever I talk to people, the one thing which they tell that why are they moving to UK is first because most of these have already done their specialization and super specialization in India, so they don't have that enthusiasm to kind of give USMLE again, and that is one factor which tempts them to go towards the UK. And another thing which they kind of tell is about the work-life balance. They say that, okay, the work-life balance in UK is far better as compared to any other country. So I get it. I mean, as compared to US, it would be a bit better. We just want your perspective. Okay, while doing a residency or probably a fellowship, you might not expect the best of the work-life balance, but let's say after this education is completed, after you have done your residency or a fellowship, let's compare consultant to consultant. Like once you become a consultant, hopefully we all will become soon enough. But yeah, like if at all we compare the consultant to consultant, what do you feel like? Like, is there a work-life balance, or even the consultants like stretch a lot and they work a lot and all those things? So yeah, please tell us about it.
Okay, so let me give you, that's a very good question. When you talk about work-life balance, of course, there are a lot of personal perspectives to that, but I would just give you a general purview, which I have felt. So let me take 3 physicians, and we'll talk of surgeons today. So we have 3 surgeons. One is practicing in India in a corporate setup because we want money to be almost equal now. Second one is working in the England or any Commonwealth country which has NHS system. And the third is working in United States. So most of the times, the number of hours which you spend in the hospital are almost similar, especially between India and United States. The most important thing is the time you start with. So the time you start, United States generally, they work on daylight saving. So we'll not talk about daylight saving, but they work pretty, start early and end early. So they start their cases by 7:30. They want everything to be on the system. Even the government offices, driving license office opens at 7:30 a.m. in the morning, which you never find technically in India. Yeah. So they start early, but they try to end up early. By 5 o'clock, they would try to wind up and they would try to go home, after 5 o'clock. And so they would have a habit of having early dinner, like, by 7 or 8, they would have dinner. And then by 9, they would sleep. And then they again start their day. So they wake up at 4:30 or 5 and they, all the household stuff. And by 7, they try to reach the hospital. So that's the one work-life balance. I'm not going to use good or bad. The second work-life balance, let's talk about Indian setup. So Indian system, they also start OR generally at 8 o'clock. Residents come at 7 o'clock, but consultants mostly come around 8 o'clock if you have an OR. And if you don't have an OR, you come at 9 o'clock for the clinics. So in states, the clinic day, they also start at 8 o'clock. So everything starts on 8, you should be in the hospital, whether you have operating room or clinic or around. While in India, if you have an OR, you start at 8 o'clock. But if you are in a clinic, you might start 9:30 on your base, But most of the times in India, you're starting late, and depending on your aggression of the surgery and booking of cases, you can end up from 5 p.m. to up to 10 p.m. And that's completely on a personal perspective and your perspective work dealing with the corporate hospital or with the hospital working. Mostly the government hospitals, they would end up by 5, A lot of times, and they would not induce patient even after 3 in government hospitals. So that's so a lot of things are very subjective in India. And now we talk about the third scenario, which is generally in Commonwealth nation when you are in the NHS system. So you are paid a fixed amount by the government setup and you have a time-bound work. So you generally again start early, like around 7 or 8, but mostly 99% of time you end up early, around 4 or 5 o'clock. So you are paid at a capping and you have some capping hours, but you have a quality of work. So very briefly, if I tell you, quality of work and money, United States of America. Quality of work, less money, England or some common NHS system. And in India, everything is subjective. Quality of work is, of course, doubtful there. You might be lucky, so you're just getting referrals and you have good practice. If you do good work, it takes time. And money is also the sky. They call it sky is the limit in India. So, and this is, when you're doing long cases, but many times you would do a lot of, because if you're a urology, so you would have a lot of short cases like, endourology cases, andrology cases. Sometimes reconstructors are shorter, sometimes they are longer. So all this time frame is very subjective. You might post only one case or 2 cases and you might go back early on that day. You might post 5 cases because you have some other commitments over the week and you want to complete that caseload of the department. So you want to hand over 5 long, you were working till 8 o'clock even on that day. So of course the operating time you spend is mostly subjective. The oncologists or transplant surgeons conventionally spend longer time in the OR compared to the andrology services or endourology services, but that's again very subjective, and I don't want to make any comment on particular specialty. This is for the normal work-life balance, and then we call off weekends where the main major difference comes in. So when you are on a weekend in any group like category A country, developed countries, most of the times on Saturday, Sunday you are free. You just take a call on one particular weekend over a month or 2 months depending on the staffing. And so at that time you're in the hospital covering everything. But mostly you don't end up working on the weekends unless you are in the non-university practice in the United States and also working in a private setup or your own practice, which is very rare for any international graduate to have their own practice or working like a locum in England. Then you might work on weekends and you might want to get some more pay on that. In India, except from government setups, you mostly land up working on a weekends, which actually is a very sad part, because weekends form a very important part of your family relationship, work-life balance, which you call. Because if you end up working on Saturday and Sundays, so the whole week is consumed with your work, and so there's nothing called a work-life balance. I've known a lot of dermatologists who would work on Saturday, Sunday, but they would close on Monday or Tuesday because they would not have much patients on a weekday. So that's again something to think on how to do work balance in India. So yeah, that's mainly on the professional life.
So to sum up, okay, so we are not taking into consideration somebody who has their own hospital or their big setup in India. So yeah, that's something which is separate. But if at all to summarize what I understood out of it, so work-life balance is somewhere between India and UK. That's what you would like to say. Like in US, it is like slightly better than India and like slightly worse than UK, right? I guess that's what you wanted to say over here. Okay. Okay, now what were the difficulties? Like you went there, I guess approximately 1 year back. At this point of time, you're working there. You have 1 more year of the fellowship to go ahead. So what were the difficulties which you faced? Like obviously, I'm sure everything wouldn't be like very, very easy pathway and always the pasture seems greener on the other side. Let's talk about the ground reality. What were the actual difficulties which you faced, and not just on the personal aspects, because I know that there we don't have the uh, support system which we have in India, but also on the professional aspect. Like what are the difficulties, and also tell us, let's say if at all at this point of time you or any other graduate who basically goes there to pursue their fellowship or something, and if at all they want to stay there for a long period of time, so what are the pathways and what are the difficulties which one might encounter in that particular scenario?
Yeah, very nice question, Pawan. So I like one of my seniors said that when you come to States for the first time, it is daunting. And it's literally daunting. When you shift on, there's so much cultural change. You speak English, but there's so many changes. Particularly, I had the fortune, I was there for 2 months at University of Pennsylvania during my internship. So I had got some idea how things work, but I never, lived with a family. I had a wife, now I have a baby. So working and shifting in United States, initially you have a lot of paperwork. And that will take, hell out of you. You'll be so disappointed. Yeah, it's something called social security. You will be having your driving license. You'll have to have electricity and all the connections in your name. And not only this is, for administrative stuff, which you have to settle up. Apart from that, when you go to your departments, if your coordinators are not very known international staff or not very international friendly, there would be always a lot of problem with your documentation, degrees, certificate, diplomas. They would to verify that, and they would not understand the terminology, because in US you get a separate internship certificate. In India also we get it, but we never bother about it because it's a part of MBBS. So they have pre-med, med. So the structure is pretty different. So they want only one urology residency certificate stating for 5 years. However, we have 3 year general surgery and 3 year urology. So we have 2 certificates, So I tell them that 6 years. I have trained in urology rather, not 5 years. So they have to. So there's a lot of this stuff, but your program coordinator, program director need to help on that stuff. And if they have taken you, they would help you, because once you are in their system, so you feel really, very disappointed, depressed, and then you don't have a lot of social life immediately. You try to find out your friends. So just I joined the Indians Association of San Antonio initially. I used to go to their, events like Independence Day, which happens in August. So that's the first event generally when you come in after July. Then you have a lot of Diwali and all that stuff. So you go to the Indian store markets and you find some acquaintance. You go to your workplace, you might find some acquaintance. So you try to build up your lobby or a network. And generally, because we Indians are very good at adapting. So mostly we tend to adapt, and we are very quick learners, the system of parking and the system of, ticketing. So India mein chalan bolte hain, they call it a ticket, and how it comes, how do you pay that. Most of the things are pretty streamlined, because the good part of the United States is mostly people they have a lot of immigration population. So things have been simplified for them. If you go, I don't know if you go to Germany or France where things will be simple or not that way, but it's pretty formatted. That okay, this is the way you have to do. So I read that driving license textbook. It's an 80 pages textbook. I gave my exam next day, theory. Then I was driving in India, but the driving is completely reverse. So then you have something called vaccinations. So they want your all bureau of vaccinations. So you have to have, all your PCG, DPT, MMR and all that stuff. You have to have a document that you're vaccinated. And then we'll always test positive for BCG by their PPD test. So you'll end up getting chest X-ray annually. So there are a lot of these things, small petty things, but they have everything on paper. You just follow that. Don't try to find logic in everything, because the system is for United States people. It's not for you. But try to delve into it, intermingle it, and you will find your way. So these are certain things, but gradually, as you get adjusted and know the things. And secondly, if you're a surgeon, you would have to, of course, gather that accent, which mostly we understand English, but the people are in mask and they would have certain terminology which they use, so which takes time. Then all the instruments, a lot of things are called very differently here. So it takes time to adjust that. So, but once you know them, know them. Next time you call it that way only. So that might be different even within United States between hospitals. So that I don't know. But so these are the things. But mostly we can adapt to that. That should not be a problem.
Okay, so you talked about the professional difficulties which the person faces while going through in the paperwork, documentation, and getting all the electricity and all the connections and the driving license and all. But what about the personal relationships? Like in India, you have friends whom you can call at the middle of the night and talk about anything. So, such deep relations, like, are they easy to like form with the colleagues, the new colleagues which you form over there? Or like, is the community per se acceptable to it? And like, how much time, or like, is it feasible to form the deep relationship at this stage of life? We are already married, probably many of us might have children by the time we start our career over there. So will we be forming our deep relationship over a period of time?
Yeah, that's a very nice question, basically. So, you have to understand that American culture is pretty open culture. You have a lot of immigrants and a lot of Indian lobby around.
Okay.
So, forming relation is not a problem. Generally, you go to your workplace. Like when I came in, of course, you don't have a lot of family here, but what they say, that you choose your family in form of friends. That's very true when you live outside India, because in India, you always have a lot of family which will give you as a backup. And then, of course, your friends which have formed over your training years. Similarly, it takes time to form deep relations, but then you would gradually find your friends in your workplace, in your neighborhood. Like I joined the Indian Association. Mostly, you have Indian Association at every place in the United States of their town or city or their state. You go to their events and you make friends. Time is always crucial, so it takes time to form deep relations. But normally you develop friends which will stand with you during your times. And they also understand that, not many of the Indian people who would come to States would have big families around. So they know that friends act as family. So people, bond together, gel in, and they will always be there in your need. And then you always be there in your need. Like a very simple incident is when I go to airport, to drop off or to pick up. So we often have friends who help us, dropping us to the airport, or sometimes when we want to go to other city, and so we always club together and go there. So that's a very natural process, and it happens. Of course, you don't get friends and people like embarging you in the night, midnight or something like that, because people do give a lot of space, and everyone is so busy professionally, and you don't have any social support system, strong support system as a form of house help or stuff like that. So when you wake up, you do a lot of household activities. When you come back, then you do a lot of household stuff, which is often get unnoticed or not taken care of automatically in India. So people don't really embarge you in the midnight. They respect your time, they give you space, but you develop good relations. So that should not be a problem here.
And another thing which I feel, obviously I have never been there, I have never worked in the department over there, but I guess there is a lot of cultural difference, like the way we are brought up, like the way we do things. Many of those things would be very, very awkward when you which would be very, very normal in India. If at all you do that in US, probably that would be very, very awkward. So I know that during residency, people they hang out a lot, and they kind of have some parties and all those particular things in order to develop that bond. Do we see same kind of things during fellowship, or in the fellowship it's more like a professional relationship or something? Like, just brief us about. I guess it will vary from branch to branch and from department to department, but like, what is your experience at this point of time? Yeah.
So generally, that's the college ragging that I don't know, nowadays it's not happening. Like when you used to have college ragging. So the concept is when a similar group of people or a different group of people is subjected to a similar circumstance, they gel in together. So like, when you are a first year in your college, a lot of people come from different backgrounds, but they now start living in same hostel, and they are now facing same situation of, loneliness or coming to the new atmosphere environment, and they find their friends and they gel in together. Similarly, like, when you do residency or fellowship, how much different you are, but because you have to do same work, you have to be the same hospital, so you always gel in. So generally, you all, especially your batchmates, they generally the crimes of the partner of the similar crime, same stuff. So they always gel in. They'll always talk similar because they always help each other. They know they have to stand together. Regarding juniors and the gel bonding and the parties in residency or in fellowship, so they do parties. Always, a lot of people hang out together on weekends. But of course, a lot of people who have got their families, even in India, if you're a resident and you have a family, then commitments, change. You have to give more time to your family. So you might not always go to, the parties as compared to when you're a bachelor and just enjoying. And many of the times in states, when you have become a resident, because there's a long career, pre-med, med, many of the people are married and they have their family, even kids. So not that often you would find them, doing partying late nights. But if you're a bachelor or if you're a young group of people, so you would work in the same way as anywhere, like any part of the country or world, I think it stands true. So the bonding is good. Of course, you give more respect in professional places and you become more, formal in that work ethics. But it's mostly similar. Yeah.
So, like, you mean to say that over a period of time, you will end up developing good relationships with people, and you will have that kind of bond which you would have had, let's say, in India or something like that. Okay, and your place at this point of time, you have joined as a fellow. So along with you, are there other colleagues, or you're the only one in your batch at this point?
So this center had only one seat for Uro-oncology fellow. So I have one urogynecology fellow with me. Okay. I have one my senior and one my juniors. One seat every year they have. So I don't have my contemporary fellow, but I often gel in with the chief residents because they are just next to me and they are the ones managing the ward rosters and everything. So yeah, so I don't but I sit along with my senior fellow a lot. Now he has finished his fellowship now. The new incoming fellow, so we talk a lot about the stuff. So that's so we gel in. I think that should not be even bothersome for many. It would you have to just give time to it and things would be okay.
Now, I have talked to you about this a bit in the past, but just tell me about, let's say if at all somebody wants to stay in US for a long time. There is one pathway in which they can do the fellowship and maybe get a local license and work in that particular state for a prolonged period of time, but there's no fixed period after which they might be board certified and after which they might get a citizenship of US and all. And another pathway is to go through the residency route, I guess, right? So just tell the pros and cons of both, and are both doable or not doable, just your take on these particular things.
So first of all, that if you want to stay in United States, it is doable. It is 100% doable. Either you come through residency path, either do your fellowship path. Just to elaborate on the path, exactly what we are talking about for our viewers. So either you do come in directly doing a fellowship when you have done your residency there, and now you're doing a clinical fellowship. That's more important. You're doing a clinical fellowship. So you can get a license through the university because you are not board certified. So what does board certified means basically? So whenever you do your residency in the United States, there is a board for each of the department, each of the specialty, and you have to give the exams, and they will, once you pass their exams, so generally people give, first exam during first or second year of residency, and the step 2 of that boards, when you just complete your residency. Once you get that board certification, by the time you have not got board certified, you are called board eligible. So you'll often see the terms BE or BC. So BE is board eligible. So you are board eligible because you are doing your residency in a GME accredited program. And once you do that exam stuff, you'll get the board certification. So you're board certified then. That opens you for Pan America licensing. So you can practice practice in any state. You have to just apply for that license. And that happens in India too. Like, if you are working in Delhi and you work from Gujarat, you have to transfer your medical license to that particular state.
Right.
So that's similar stuff. So if you're board certified, that stuff becomes very easy. Just like, submit your papers and they will give you a board, license for that particular state. So if you do your residency in the United States, even after doing anything, doing fellowship or not doing fellowship, just come in directly. So you are board certified. With board certification, you've got independence to practice anywhere. You're not dependent on licensing anywhere because you have the board certification with you. So you have got more vistas open to you, more opportunities. You can decide your place and all that stuff. So that's easy. That's like an American graduate, nothing more around that. Your visa might play some role because generally residencies sponsor J1 visas, but you might get H1 visas. So there are two types of common visas which the doctors get in United States. So first, which is most common, is a J1, which is called a student visa basically. So you are coming here as a student, you will do your training, and as officially, you are supposed to go back to India after your training as per the Government of India policy. This visa is in the exchange policy type that Government of India is sending their doctors for training in India, in United States, and they have to come back. That's what the clause says. So that's how, so United States and India worked out a way that if they want to overcome this clause, they don't want to come back and this for minimum 2 years. So anyone who comes on J1 visa with a clinical stuff, or with sometimes even research, they put this label, 2-year country home requirement. So when you get the visa stamped on your passport, so you will get this stamp written at the same time, 2-year home country requirement. So that means once your visa expires, you have to be stay in 2-year home country. But there is a way out for that. If you can do a waiver job, that means you do a job in United States in an underserved area. So they made some qualifiers for that, and these are the jobs which qualify for J1 waivers. So there you'll get a normal job visa sponsorship, which is H1B. So H1B is a job visa. So it will be essentially a sponsorship for H1B, but that should also be eligible for a J1 waiver, that job opportunity. So that, and how does that come in place? So United States has specialized locations and their agencies which will work on this. So you apply to them. So wherever you find the job, you tell that particular department or the institute that I'm looking for a waiver qualifier. So they will tell you first whether we are eligible or not. And that comes in. Most places are eligible because they always serve some underserved area, except, main New York, main San Francisco. That is a separate city, but you'll have outskirts of that city which are serving there. And if they are eligible, they will apply to the government through a program which is called Conrad 30 program. There you apply and they get approved, that waiver. So mostly, and so every state generally has 30 seats for this waiver. So there generally that's and there are other ways of waiver, but Conrad 30 is the standard, most common way which people use. So that institute then applies to that particular government body that we have this candidate, he needs a waiver qualifier, and they would gradually approve that. It takes time, 6-7 months. If it doesn't get approved, then you have to go back. But mostly the institutes, because they are putting money on you, you are getting a job there. So they are able to, find out their way using the immigrant lawyers and all that. It's just about a paperwork. So that's our J1 visa and H1 visa. If you are doing your training on H1 visa, then you just need to continue a sponsorship. You don't need to do this waiver stuff. So you're pretty open to the places. Third visa is O visa. O visa is something different to get. It's basically an extraordinary visa that you have some good research, good publication, good letter of recommendations. Then you can switch to O visa, and you can do this either from J1 or H1 or come directly also on that. So O1 visa is generally given for 1 year to 3 years. And once you get the O1 visa, so there is no waiver requirement on that. So just keep on continuing your O1 visa. You can apply green card on O1 visa or H1 visa. Generally cannot apply a green card on J visa. Or there's another student visa which is called F visa, which is generally taken by the technical students like MBA or Bachelor or Masters in Surgery science students. So you don't generally apply green cards on that, but you can apply green cards on O and your H1B visa. So that's the visa issue. Second is the licensing issue. So licensing If you have done your board certificate, resident or GME accredited program, you get a board certified, you get license anywhere. If you have not done your board certification, so the licensing is generally done by the help of the institute in which you are working. They will get you a limited license or a faculty license, something like that. And so whatever money you are generating for the department of billing, it goes to the department and they will give you some fraction, whatever they want to give you. So why do we need this licensing or board certification? It's basically a lot of insurance companies won't want to bill you or pay you if you are not board certified. So, and that's the trouble. So that is the trouble taken care of by the institute who is sponsoring you the license for that particular state. And now why would an institute sponsor your license? So like, why would the institute take so much pay? So it's generally those states where they don't find board certified people a lot easily, or you are of some extraordinary capacity to treat, like to start with, like you can do robotic surgery and others cannot do who are coming with their applicant, then they would try to sponsor you the visa or that license. Sorry. Now, when you are on their license, so you are bound to that university because you are not board certified. So you become in sort of that, restricted your practice. You'll have good money. Your money might not differ that well, like that. The money difference is not that great between board certification and non-board certification, but your capacity to operate or your capacity to expand your research, your vistas are limited because of the licensing. Now, how do you get board certification in urology without doing a residency? So as per the latest guideline, they have made it like you have to work 7 years of experience in your practice in a university. So you cannot, if you do work in, private center, somewhere like that, you have to have a university system practice of 7 years, plus you should be a full professor. So that's, it's difficult to become full professor in 7 years. You can, if that depends on the university policies. These two things together will make you eligible to apply for board certification. Then, of course, you need to have some letter of recommendation, a good CV, some good great publications, and all that. Then you give your exams. So you have to give the exams. It's not that, you get something. So you give the same exams, and for giving those exams, this is the eligibility. And once you give your exams, which include theory as well as practical, then you get a board certification. Once you're board certified, then there is no difference whether you got certification by residency or via this ancillary path. So these are certain technical glitches, but most of the things will work out because there are not many urologists, particularly in the areas, remoter areas, or in the area, particularly Pennsylvania, Dakota, Iowa. A lot of states which are very international friendly, giving you opportunities. They would sponsor you the visa as well. They would even help you qualify as a waiver. And of course, they will sponsor your license. It's only like your wish, and you have to really search hard because urology is not classically easily available for waivers. Waivers are mostly available in underserved area for medicine, psychiatry, OBG, and pediatrics. These are 4 prime or emergency medicine. These are the branches which will very easily get waivers. But for urology also, they are available, but you have to really do some hard work on that. It's not impossible, but it's tricky.
So a couple of questions. You said that if you switch to O visa, then you don't need to do waivers. So just for my understanding, let's say if at all you are on J visa and you switch to O, you still will have to do the waiver, I guess, right?
If you come directly to O visa, then no waiver.
Okay.
If you have a J visa ever in your life, even if you switch to O and then you get a green card also, still you will not get a green card before you do a waiver. So waiver is something which is stick to you when you have a J1 with a stamping written on that to your home requirement.
And another thing is, like, let's say if at all I come to US and I have a J visa, and then for 2 years I don't return back to India, I go to some other country, it will not qualify the J1. Like, it will not qualify the waiver. You have to go to your home country.
Yeah, so that is, and you have to report to the government of India. Of course, a lot of people tried to report them. The government of India didn't know what to do with them, like if they have come back. So there are certain administrative glitches right now because it's in the clause. Even I have to sign a bond. You sign a bond of like 5 or 10 lakhs, something like that money. And if you don't come back and you are doing a waiver, then also you have to pay the government of India that bond amount. And for that bond amount, I have to attach a lot of paperwork from your father or mother, the property, the account details, and all that stuff. But people haven't tried to pay that money to the government of India. But there are no really right ways how to do that. And so some things are, let's figure out how they work. So, but officially that's, you have to go back, or you do a 3-year waiver. So it's a 3-year waiver or a 2-year home residency.
Thing is, let's say there's one state and I do my fellowship from Institute A, and there is Institute B which is in the same state. After completing my fellowship, am I allowed or am I eligible to work in this Institute B in the same state? Am I or not? I will be bound to that institute or in that state.
So basically, your work does not matter. Even if you have done your training in India, you are step qualified if otherwise. And you are eligible to work in United States.
Correct.
Anywhere. Irrespective. If you are trained in United States, the opportunities become better. But even you'll find a lot of Indian faculties coming in from India and coming directly to States without doing any training here, based on your credentialing and work performance and their requirements. So the need versus demand match, demand versus availability match. So if the university is ready to sponsor your license, if they are ready to sponsor your visa, you can work anywhere, irrespective where you have done fellowship. If you do in the same state, things would be easier in licensing, in the sense, you already had this limited license, some license with the state, they can switch easily. If you go to a different state, so every state has different clause for need of requirement of licensing. So you might have to do things. But it's completely on that particular university. If they want you, they'll get you that licensing stuff. They'll help you getting that paperwork done.
Okay. So it's not like after completing my fellowship, I inadvertently get the license. It's not like that. I will get the license only if that institute wants me or that university wants me. Only then they might request the state authorities and I might end up getting the license of that.
True. So when you apply for your license, you tell them that I am moving from this. So what your previous license? You'll go, okay, I have this previous license. There is a trainee license, limited license, faculty license. And I'm now going to job here. It's not like I'm not having job, but still I can get a license. No. You have to show that my appointment letter is from this university. And so I want to get a license. And then they will tell you whether you're eligible or not, or what are the pros and cons, paperwork.
Okay. Obviously, that institute will help me out if at all they are wanting to. Okay. Another thing you mentioned was that you have to work as an institutional practice for 7 years, right? Right. So we can switch from state to state, or it's like at the same place you have to do it for 7 years?
So generally people tend to stay in the same place for 7 years because you need to build up your CV so you get good publications, good letter recommendations. But it never says that you have to be in the same university. It never says that. It says university practice for 7 years. So even if you are lucky or great enough that you are getting 2 universities sponsoring you and you are getting promoted faster there, so then that should work most probably. But mostly people land up spending the same time in the same institute to build up, that rapport and work profile.
And you said that under the clauses you have to become a professor. So what is the criteria of becoming a professor, like the full professor?
So generally it works like that you joined as an assistant professor, then in 3 years you become associate, and next 3 years you become professor. So there's no additional professor here. In India, you have assistant, associate, additional, and full professor. And in here, you have assistant, associate, and a professor there. But if you have trials, generally by 7 years, you should be able to become a professor. If things don't, unless people move in from different places and all that stuff.
It might take a couple of years more, but more.
You should be able to become a professor in 7 years. But and a lot of things also work in becoming a professor, like how many grants you were able to get, how many funding you were able to generate, and how many trials you were able to do. So all that
personality
matters. Yeah.
Okay. And this 7 years of working in the institute, does it include your fellowship or it doesn't include your fellowship? Like after fellowship 7 years, or does it includes the period of your fellowship?
So it never says 7 years of anything in practice. apart from a resident. So a lot of times fellows get a limited license or a faculty license, so that they should include. But if you are in a trainee license, so that would not
So it
include.
again boils down
But
to
for
what license you
after
are.
residency, generally it is post residency. So mostly people, most of the times, they would try to include this. 7
Okay.
years you would try to dwell in. The limitation is now more of a professor, becoming a
Because
professor.
anyways you are going to spend 7-8 years in order to
7
become
years,
the professor.
because I generally don't become professor within 7 years.
6 years, after fellowship. Got it.
So generally your fellowship experience would count if you are, rapid movement of professor.
Okay.
Yeah.
So this was about the fellowship route, which you basically talked about. Now, how difficult it is to get into a residency program in US, like if at all you do a fellowship or something?
Yeah, so that's about a match. Statistics would give you an idea on that for IMGs. Generally, they say 1 to 2% of IMGs matched in the urology residency program. So if you have 400 seats, generally 8 or 10 IMGs. That's for urology residency specialty. However, as what I saw this year, match statistics, overall IMGs, had a 50% to 55%, some percentage increase was there in the fraction of IMGs getting branches. But when you talk of the urology branch per se, the trend is going on a decreasing trend. So a lot of universities would not prefer IMGs. It's something to do with the internal ranking and politics, so let's not go into that. But mostly, if you have good credentials, if you have good step scores matter a lot in your residency match. Irrespective of your profile of publication. So now you don't have marks in step 1. So now the whole emphasis on step 2. You should have scores of 230 or 240 because urology is among top 5 surgical specialties for the match process. So, and of course, along with that, your letter of recommendations, your previous. So one important thing when you're applying for any match, even for residency or fellowship, so the places where you have worked, you need to have good letter of recommendation from that places. So just try to maintain good terms with the people you are working with, your program directors or program, coordinators, which should write a good letter, and in that letter of recommendation, they will just want you to write your general knowledge, curiosity, tendency to learn, and whether you are a good team player or not. A lot of people would not like that sentence in the letter of recommendation. And so that's very important that you should have good spirits, you are a good team player. We always look that in your, letter of recommendation whenever there is a question for a match for anything. So I think you'll get and try to connect some senior who has done this similar stuff. So he will give you a lot of, quick formats for these things, because in India, letter of recommendations are not that taken so stringently, which are taken in states. So yeah, that's the way. If you do a residency there as an IMG, so you'll get into the system, and then you are equivalent to an American graduate. And then there is only a problem with the visa sponsorship. And that also, once you join as a faculty or somewhere, you try to ask that university to help you getting green card. There is some queue waiting for the green card. But if you have good publication or citation, you can get through a specialized queue, and you get in touch with a good immigrant attorney. That's a lawyer, we call them attorney. So, and he will help you doing the paperwork, and things should work out in your favor. But of course, they take time. But even if you don't have green card, if you have a visa sponsorship, generally just look on to you, always be vigilant when your visa is getting over, and try to get re-sponsorship with your institute, get in touch on time, and then only stamping is an issue. Otherwise, things won't be much different. Yeah.
So you mentioned about the O visa, right? So the specialized queue is the same as O visa, or is it different?
So there are queues for green card are called by EB1, EB2, EB3 pathways. So if you have an O visa, so EB normal line is through EB2. EB1 is, for extraordinary or some categories. Okay. So there's a whole lot of categories which are eligible to apply through EB1, which is a relatively rapid process to get a green card. Since I have not been into that process particularly right now, I could not get the finer details of that. But either you have O visa or H1B visa, both of them could go to the EB1 based on your credentialing, how the immigrant lawyer or how you file the paperwork. there are certain criteria that you should have at least some citations, around 500 or something like that. And then your country of residence plays a very important role. Like a lot of people from Middle East or even for Nepal, because we are Indian. So Nepal has a very quick, getting green card even through regular line. While Indians Indians and Chinese waiting for a extraordinary credentialing line is far longer compared to a Nepali citizen with a regular line, because not many people from Nepal come in, and generally it's a criteria like no country residents more than 7%. Like suppose America is going to give 100 green cards this year, so 7% is the maximum cap for a particular country of residence. So even if you're like 1,000 Indians have applied, only 7 would get in case 100 green cards are being issued. While if in Nepal, 5 people or 100 people applied, so 7 would only get maximum.
So they don't take into consideration the area or the number of people applying.
So the percentage is a percentage that matters. So of course you have a larger population.
O visa has nothing to do with the line. That is like entirely separate. That's the EB1 line. Anybody can try to go through the EB1 line. It is just that if you have the O visa, probably you will fulfill the criteria for the EB1 line.
Or EB1 as well. But even for H1B visa also, you can
apply for the EB1 if at all you have the credentials. Okay.
Yeah.
Okay, and another thing, like say if at all I'm doing my urology training at this point of time, and I'm sure many others who are doing training might be looking forward to go through this path. Does coming to US for observership, or let's say to attend the AUA conference and trying to connect with people, does it really help, or is it just talked about, or does it actually helps at the ground level to get into a fellowship or a residency or something like that, just to come there and connect with people and all those things?
So it should help. Like if I just put the answer at yes or no, so yes, it should help. In my case, I never attended AUA before that, and I did not do any observership because I applied as a chief resident and then directly landed up in a fellowship, which is an AUA accredited fellowship. Okay. But your CV speaks as well as your contacts speak. So for making your contacts, either American people coming to Indian conferences and you're getting interacted with them, or you coming to an American conference interacting with them, both really matters. But even if you interact, there is no guarantee that they will give you your position. That's number one. But at least you know that. Number two is your observerships. So people tend to do observerships. You try to find observerships. A lot of people in states, they would give you observerships. Observerships are not very difficult to find. With COVID times, there were certain restrictions because of the international travel. They said that IMGs would not be coming for observership and all that stuff. But now, as COVID is, pacing down, so things are opening up in states. But you should always try to find an observership at a place where they take international people for fellowship or for residency. Like, for example, I know one of my friends, he went to Stanford, and Stanford doesn't take non-US accredited residents to their fellowship program. So there's no point, beating around the bush. If they don't take it because you are not ACGME accredited resident, because you have not done training of residency in the United States, which is their eligibility for fellowship, so you don't qualify. So even if you do, 2-year observership there, you're not going to land in because you're not on black and white in them. So always see which places not only give observership, but they also give you training opportunities after your observership. So that's something research you have to do, because don't fall prey to the system of observerships blankly, because a lot of American faculties, they would get you observership, they don't have to pay you anything, you rotate around. Whereas sometimes you would have to pay them sometimes. And then you are just a network for them. You go back and you don't gain anything much. No, so it's good in making contacts, but be wise with that. Yeah. Sorry, Pawan, I think you're mute.
So a quick question which just passed my mind at this point is, okay. So we talked about the timeline for the fellowship and the residency and all those things. Let's say if at all I don't match into a fellowship and I wish to do a research fellowship or a research job over there or something, is there a particular timeline, or that is basically based on individual faculty of the different institutes? First question. And another thing is, if at all I wish to apply for, let's say, a research job, how I should go about? Should I have to individually mail them, or what is the way to go ahead with that?
So there's no portal for research job, a research fellowship.
Okay.
So you just apply to that particular faculty. If he has got funding, he will take you for that research fellowship post. So you have to just be clear with your visa sponsor and all that. Like if you come on J1, so there is a J1 visa without 2-year home requirement as well.
Okay.
So there is a J1 visa when you come for research or something. Mostly you will get a 2-year home requirement automatically. But whenever you come on a J1 as a clinician, ECMG gets into picture. And when ECMG gets into picture, that puts that 2-year home requirement because you are a medical graduate doctor. But a lot of people who come as Bachelor in Science, Master's in Science, PhD, not doing any clinical stuff, they might be able to evade this 2-year home requirement story. They might. It's not that they would be able to 100%. So that's something which you have to be very clear when you are getting your visa sponsor at that own time. So that's number one. So for research fellowships or anything, you just have to contact your faculty or contacts. And mostly they would, if they have funding, they would take you, very frankly, because they don't have to guarantee you anything. They're not going to say that they will take you to residency. But if you do good job in your research fellowship and you constantly, poke around and telling them, I'm looking for residency, work hard. So they might consider you because you have some research experience. So now because you are at a level with the other medical students of America competing for the post of residency. So how the general trends work in medical students in the United States, that once they do their med school, they work as a volunteer, or even during their med school, they work as a volunteer in various research labs just to get some more exposure to research, understand the science and all that stuff. So if you're also working as a research fellow, so you are actually equating them in that level. When you give your scores for a match process, there's a column of a voluntary research experience the guy has done. So I know a lot of people who even came for the research fellowship or research positions as a research associates without being paid. Just, living on their own expenses for 6-7 months and then applying for residency. Because classically, not many medical students in the United States would get paid for that, or they would get paid very minimum. But it's more like, an experience. So just to fill in your CV. So that's a good option to start with, but don't fall prey to the system. You should have a good professor and a good program. There are people who have gone back doing research, not getting into the residency and fellowship program. There are people who have not done anything and just landed up into a clinical fellowship program. So there are both the ways open.
Right. But to get a research job, you have to directly apply, and there are chances that if you apply to many people, they might, somebody might take you, and in that way you can be in US and try your luck out and try to build your contacts or something.
True, absolutely true.
Okay. So thank you so much for sharing all these things with us. It was really valuable, and thank you for breaking all these particular things in a very crystal clear manner. We will be connecting in the future podcasts and trying to figure out more things up. Just a summary, or just let's say a bottom line or a take home message for any student who always had that particular dream or thought of coming to US, but due to some or the other reason would have. So it's not basically for the students who are trying to get into residency just after their MBBS or something, but let's say what we call it as old IMG who have done their residency, who have done their fellowships or something. Just a closing statement from your end, and I'm sure that we both will figure out something and we'll try to connect on the future talks, and hopefully if at all we have certain questions, we'll try to address them as well. So yeah, just a closing statement from you at this point.
Sure, yeah. So I think the first statement message is US is not impossible. So that's first thing. It is possible. It's very much possible. And it's very international friendly. If give your steps whenever you can without thinking much. Just give your steps whenever you have time. And so in the down that even if you don't are fully committed to states, you can give your steps. It's just like an MBBS. So give it as early as possible. Whenever the later you give it, the later it becomes more difficult because you have to read that whole biochemistry on that cycle again for the step 1 and 2. And third, try to be active and just do some good research, get involved, always build your CV. And so you'll always be getting into that system, try to make some contacts. So contacts, CV, make good reputation with your department heads and department faculties, because they are the ones who are going to be contacted in case anything, needs to be cross-checked on your CV. So just maintain good terms with them. Don't do anything overtly, enthusiastically right or wrong. Just keep your composure. And it is achievable. It is well achievable. And even when you come to states, there are ways you can settle down. It's pretty friendly, immigration friendly state compared to other countries. So just that's the whole message. And always we can have some other discussions if we want to have more clarifications on the visas and all that stuff. But yeah, just do it, go for it if you want it. And there's nothing, it's not at all impossible. It is very, very much possible, very easily possible. And yeah, thank you so much, Pawan, for having me here and giving me an opportunity to discuss some intricacies of this fellowship and residency program.
Thank you so much for your sharing.
Thank you, and to all of you, best of luck if you're trying to find your way coming to States for training.
That's definitely. Thank you so much, and yeah, see you soon. Bye-bye. Take care.
Bye.